Hello there, this is Dr. Zachary Ward here in Auburn Hills, Michigan, looking at 10 patients in 10 minutes. Looking at a case that originally started with pretty serious vertigo, but when we discussed the fact that a lot of vertigo and dizziness is related to improper neck mechanics, this gentleman decided to work with me over time to see what kind of changes we could get in his cervical curve, as well as keep that vertigo at bay. So we're actually going to look at 3 X-rays spread out over 4 years. So when he originally starts off, this is before there's any kind of adjustment or correction. The back of the first cervical vertebrae and the back of the skull are very close to each other. The middle of the upper neck, which is right here, is very far away from the middle of the lower neck, which is back here. And then when we go to the lower neck, what we're going to see between C5 and C6 is an opposite angulation, taking this into a reverse cervical curve down here, as opposed to being curved forward, which is where it should be. Now, if we look at him a year later, most of his symptoms have subsided, and we can see some shifts and changes. The back of the first cervical vertebrae is coming away from the back of his skull. The middle of the top of the neck is closer to the middle of the bottom of the neck. And then when we look at C5 and C6 down here, that reverse angulation has come out, and you're seeing a straight neck down here at the bottom, as opposed to it being in the beginning of a reverse cervical curve. So this gentleman would follow up with me every 4 to 8 weeks over the next several years, and we would just continue to make sure that his neck maintained its alignment. And what we'll see is that this stays relatively balanced in the C1 back of skull position. The middle of his neck now gets even closer to the middle portion of the lower neck. There's no return of the reverse angulation, and overall, the neck that used to be way back here has now moved forward, and of course that vertigo is never really an issue anymore. If you have any question about this case or any other case you see in this series, you can go ahead and contact me via my contact box on laachiro.com. If you're in my area, you're welcome to call 248-598-4002. You will get someone immediately if you call between 10 a.m. and 2 p.m. usually. Other times we may not be able to answer the phone right away. Or you can look at me at Facebook at laachiropractic.com. Have a great day.